You're listening to Evaluate This, a limited series podcast from the UK Evaluation Society and sponsored by Digital Science.
Hello everyone and welcome to this new podcast for the UK Evaluation Society. I am Dr. Jessica Ozan. I head the Education, Children and Families team at Ipsos, and today I will be speaking with Dr. Facundo Herrera about his PhD research. Facundo, for his PhD, dived into the causation or the links between education and mental health and moved beyond simple correlations to explore how could we actually establish if there is a causation between the two. So this is the content of today's podcast, with the title being More School, Better Mental Health, What the Evidence Really Says. This is quite a technical conversation where we are going to talk about different ways of doing impact evaluation, and we will cover like QED methodologies. So we will try to make it as exciting and accessible as possible. Hello, Facundo. Could you maybe spend a minute or so introducing yourself and your academic and professional career?
Thank you very much, Jessica, for having me. I am a senior economist. I am an associate director at Ipsos UK, and I've been working in evaluation for the last roughly 15 years or more in Europe, mostly always working in mixed methods, as it is often the case, but I have grown much into the counterfactual approach to evaluation, to impact evaluation, and mostly dealing with randomized control trials or quasi-experimental designs. And a number of years ago, I also decided that I wanted to conduct doctoral studies at Lancaster University. And the topic of this conversation today is exactly on one of the research I've done at Lancaster University.
And could you tell us what motivated you to pick this topic for your PhD?
I've been always quite interested in the intersections of health and education. I've been always focused on education policy, social policy broadly speaking, but then my PhD was focused on health. And I also was quite interested in inequities. And in the UK, in the last couple of years, there has been a whole debate about ethnic inequalities and as well gender inequalities. And I found that intersectionality, having an intersectional lens on this is always interesting.
That's great. And we know that health and especially mental health is a key concern for parents. Actually, like the data we have at Ipsos tells us that it is the most important concern for parents, quite far ahead from academic performance, for instance. But we also know that schools are often presented as a solution to inequality, and potentially we could try to stretch that to, is it a solution to mental health inequality? Would you like to say a bit more about that?
Yeah, I think, well, it has been a whole, always in the academic debate, but also the policy debate, that what is the link of education and health, and how education could be a lever for improving equity. And the key problem is that education tends to be conflated with so many other factors. And the key question that is often missing is whether the link is causal or not. So we know very well of the association between education and health, because health education impacts income, housing, job security, and also other positive behaviors. The question is whether it's causal or not.
So I guess this is what we're going to explore in this podcast. What is the main question you wanted to answer with your study?
I think the main question I wanted to answer is whether more education can causally impact positively mental health in the long term, but mostly within ethnic minorities, because as I was saying, there was long in the debate that in the general population there was research done there that the impact was positive or sometimes not significant. There is a whole debate within the UK and outside, but the real gap was research within ethnic minorities. I think we constantly treat education as a fix for inequality, so it is worth knowing whether it delivers for the people that mostly need the help or not.
And so when you say more education, are we talking about more time at school with like issues such as attendance? Are we talking about going into higher education? What exactly is more education?
Yeah, so most of the time is more education. There is also literature on type of education. Now, in when I could do research in the context of my PhD was exploiting because the challenge was to try to answer this in a causal manner, and there was already in the literature interesting attempts to exploit reforms, so policy decisions that arrive as a shock and then can be used as a natural experiment. And one of the most common strategy is to exploit these measures that aim to increase the basically raising the school living age. So there was one opportunity there, and that was exploiting that. So it is exactly years time in education, informal, in full-time education. Yeah.
Okay. So young people staying in education for longer. And could you tell us why do policymakers so often assume education improves mental health?
I think it might be because they certainly are aware of the association of education. They see that education is positively correlated with better jobs, income security. There is also this hypothesis that improve the certain behaviors, positive behaviors, and that has a positive effect. The point is, how do we disentangle education from other measures? Because maybe it's not education, it's something else that is going around and in the way of the pathway. So perhaps it's working on those.
And is this something you explored in your study, those different pathways? Can you tell us a bit more about it? It sounds like a complex theory of change.
Well, no. In my study, what I've taken is exploiting the 1972 Rosla reform, and that can give you basically is consistent in driving the school living age from 15 to 16, and it's basically affecting slicing the population that is born on or after September 1957. So clearly, people who born there after were supposed to stay 1 additional year, and those born before were supposed to, they were not affected. Now, the interesting of this measure is that it gives you an opportunity of a regression discontinuity design. When you have this sort of exogenous shock, because the decision of the cutoff is not associated with what people is deciding, then you have a group of people who are very, very, very similar. Around that date of birth, they are very similar. Now, it's important to say that this policy was a nudge. So some people who was supposed to stay in education, they can still drop out. And also some people who was born before, would have still continue in education, but still is a nudge. So basically you are looking at this population who was encouraged to stay in further education and see if after being in education for an additional year, there is a difference in mental health in the long term.
So what you have done, if I understand correctly, is you went back to an historical kind of like turning point in education policy and used that data of like what used to happen before that and what happened after that. Is that correct?
It's basically making use of a very good data set that we have in the UK, which is the UK HLS, the Understanding Society Survey, which has a booster for ethnic minorities. We had a very good sample, not massive, but interesting sample of ethnic minorities that were available for that date of birth. And you basically look at all of this sample before and after, born before and after. And then you compare these two groups. Those who were born before were not affected, were not encouraged to stay. So they only had to stay until 15. Those who were born after, they were supposed to stay until 16. And most of them, the vast majority, stayed. So you compare these two groups. It's almost like having a lottery that cuts into, let's say, treatment and control.
It's fascinating conditions for quasi-experimental design. And so what did it say? What did it show?
Well, we started our study looking at the association, as we often do this when we are doing a causal analysis. We start from the association of health and education, and of course we find a positive. We also look at the buy-in of the policy. We saw that there was an important take-up of the policy, so those who were supposed to stay took up the state. There was a big chunk of people before that left at 15. Now, when we went at the causal analysis of that, the association, the positive association vanished. This is not to say that education doesn't work, but the causal effect disappeared. And there are some key takeaways of that.
So does this mean that staying an extra year in school at that point in time did not improve the mental health of those young people once they... When did you look at their mental health data? Was it at the same point, or was it a few years later?
Few years later, many years later, because this, if you think of it, is people born in 1957. If you go to see the dataset today, is people of a range of age that are approximately 1 or 2 years above and below. The closer you get to the cutoff, the cleaner is the experimental group, the quasi-experimental sample, and so they are adults.
And so what age did you decide to look at their mental health data? Like how old were they when you looked at that data?
They are the ones that they have the current age now. They are, can't remember now at the top what is the equivalent, but it's people born who were born in 1957 plus 12 months or minus 12 months.
And so that was when you did your PhD in in which year?
And that was 2024.
Yeah, so they were about 67 years old?
Yes.
Okay, so it's a very long impact that you are trying to estimate.
Yes, because it's sort of the long-term impact, and that's one of the caveats that we can discuss later on. But this is not to say that the impact didn't happen. There are many hypotheses to explain that. One important point to make is that there is an element of small sample sizes, so power may play a role. However, I have used a very innovative method, which is what is called local randomization approach. Local randomization approach is very robust for small samples compared to the usual approach. So, despite having small samples, the method is quite robust to that. Of course, we cannot discard that there is an element of power. Most likely is that the effect in absolute terms is not very important. So even if it is positive, it's not very big. So you will need higher sample sizes to spot. But there might be other factors playing around, other factors that were in the background that even if you have a positive effect, they have offset the positive effects. We cannot rule out that, and we cannot test that. We can rely on other research to hypothesize that.
And then your research also focused quite specifically on ethnic minorities. What were the key findings about that?
Yeah, the interesting is that when we run this model on the white British majority, the results were also vanished, were also not significant, which means that ethnicity may not be playing a role, or may be having different kind of experience and an effect. There are different explanations as well. We have seen in the overall population sometimes that the effect also vanished. And that was one of the motivations for me to look into ethnic minorities, because you could have in the overall population not significant results, and you have different experience within different groups. It wasn't the case here either. There might be different things going on. We haven't tested in this study, but we have in the discussions engaged with qualitative research in the field. There are some key pointers. One is that when you impose a policy, you might have a counter effect. You have like an offset, so you are supposed to have a positive effect. The positive effect of education can be neutralized a bit. Then the other that we know very well is that there was a level of overcrowding, because the education system had to host more students for one additional year. So that overcrowding could have impacted, which is almost like saying the quality of education. These people was exposed to more education in terms of time, but the quality of education could have been affected. And finally, for any minority, the key point there is that we found research highlighting that for many ethnic minorities back in the days, but also today, sometimes education system can be a bit hostile, like a hostile environment. And then staying clearly one additional year in a hostile environment can have an offsetting effect. But of course, again, I haven't tested this numerically, quantitatively, but literature says that.
So now that you have all this really interesting data that moves beyond correlation and really, dives into causation, what assumptions about education policy should be considered?
Yeah, I think we reach for education as a lever for mental health. That is evidence that is more of it, but it seems that it doesn't pull the lever here. However, we need to be careful on how we interpret this, because as I said, there might be different things going around. I think that still we need to shift the question from how many years to what the years contain. So the quality of education for whom. And I will say there are a few ideas. There is people working on this. For example, we could have culturally adapted screening. Normally, standard tools are built on white population, so you might be missing things. It could be beneficial to think about strategies to equip teachers to recognize distress and how distress is manifested across different subgroups, different cultures. Should also think about community design support services and monitor disparities. I think it's key to monitor disparities in exclusion and streaming. I think if we actually care about mental health, more school can be the whole answer. That shifts the question from how many years to what those years contain.
Brilliant. And this is a cheeky question, so maybe we can delete it if you don't like it. But how do those findings land in what you currently see in your research in schools? Because you've been doing a few RCTs in school recently. Like, do those findings transfer quite well to what you currently are seeing?
I think the interesting point is that working together with many people creating interventions that are aiming at improving mental well-being or educational outcomes, I think what is missing is to almost streamline in every theory of change ready a racial equity, diversity, and inclusion lens, being a bit stronger into the intersectional lens, and put that into the theory of change. It is a there, sometimes there, but it's not at the forefront, and it can come up in data collections, in the analysis, in the protocol. So on the evaluator side, I think that we are sort of quite aware, because there is a push, of course, from the commissioners, but sometimes certain sides, especially the theory of change, I think that we could make a strong point to have that.
systematically included. I think that sounds like a great idea. And what does it mean for interventions beyond schools?
Well, for interventions beyond school, it means the same. It's also taking into account different lives experience, and that education doesn't happen in a vacuum. And this is important when you take, for example, education policy as a strategy for health equity, for example. You have a whole range of structural determinants of health and mental health. And education is one of them, and it is interacting with the others. So whenever we design an intervention, we have to have this sort of ecological ontology, let's say. You have to have a mindset that take all these factors that are happening. It's a process. People are embedded in process and experience. So all these policies need to have a comprehensive approach and take that into account.
And putting our academic hats on for a second, when one finishes a piece of research, there's always more research they want to be doing about the topic. So what would that be for you?
I would say, of course, power is important. Having running similar analysis on more data sets, and data sets that could bring bigger sample sizes, with the caveat that some datasets in the UK don't have the ethnicity booster, so that is a difficulty. Second is aggregation. So when we run these models, because of sample size, sometimes we cannot go into the different subpopulation within ethnic minorities. So we are treating ethnic minorities as an homogeneous group when actually it's not. There could be starking differences above or below the average, and that might be cancelling out. Now, sometimes it's difficult, but sometimes might be moving out from causal inference to more machine learning. That could be. Then, of course, we have the time lag that we discussed before. It's supposed to be almost like an RCT, like an as-if random. So even that we can be quite confident that we can identify these sort of effects, but there is a possibility that one kind of event has affected asymmetrically. So of course, reducing the time lag would be also interesting, and linking, maybe using more administrative data. That could be interesting.
Great. Thanks, Facundo.
This research has been published in Social Science, Medicine, Mental Health. If you want to access, you can find it in Google Scholar. It's publicly available. It's called "Does More Education Improve Mental Health for Ethnic Minorities in the UK? The Impact of Rosla, 1972."
Evaluate This is brought to you by the UK Evaluation Society, sponsored by Digital Science and co-produced with Swanky Creative. Please visit evaluation.org.uk for more information.